Welcome students. This is part 3 of the series of histamine and antihistamines. If you did not watch the previously videos, then you must watch it to boost up your concepts. Let's talk about pharmacokinetics of H1 antihistamines. There are some important points under this heading which you need to remember, and these are also given in Pharmacology by Lippincott. As you can see on your screen, the bullet points. So, let's start. H1 receptor blockers are well absorbed via oral administration with maximum serum level reach within 1 to 2 hours. Average plasma half-life is 4 to 6 hours except meclizine and second-generation drugs which have 12 to 24 hours. So, only once daily dose allowed to given. All first-generation and second-generation drugs are metabolized by hepatic cytochrome P450 system. Cetrizine and levocetrizine are excreted largely in urine, while fexofenadine excreted largely in feces. Now let's talk about the adverse effects of H1 antihistamines. The first one is sedation. The first-generation drugs such as chlorpheniramine, diphenhydramine, hydroxyzine, promethazine bind to H1 receptor and block the effect of histamine in CNS. Most frequent adverse effects of first-generation is sedation. Diphenhydramine may cause paradoxical hyperactivity in young children. Other actions includes fatigue, dizziness, lack of coordination, tremors, etc. Mostly elder patients are sensitive to these effects. Sedation is less common in second-generation drugs because they can't enter in CNS while first-generation drugs enter in CNS. The second one is other effects. As you can see on your screen, due to first-generation drugs, adverse effects occur due to anticholinergic effects. The effects includes dryness in nasal passage, dryness in oral cavity, blurred vision, retention of urine, etc. While, due to second-generation drugs, the effect occur is headache. Also, the diphenhydramine may cause local hypersensitivity reactions such as dermatitis. The third one is drug interactions. H1 blockers also interacts with other drugs, causes serious problems. Let's consider an example. Phenelzyne should not take as antihistamine because monoamine oxidase inhibitors increases the sedative and anticholinergic effects. Also, the first-generation drugs, when taken along with anticholinergic drugs, it may decease the cholinesterase inhibitor's activity in Alzheimer's disease. The fourth one is overdoses. Margin of safety of H1 blockers is high and chronic toxicity is rare. Acute poisoning usually common in young children. The dangerous effects of acute poisoning are those on the CNS, including hallucinations, excitement, ataxia, and convulsions. If these effects untreated, the patient may suffer deep coma and may collapse of cardiovascular system. Now the last topic left of this video. It is H2 antihistamines. They have little affinity for H1 blockers. The effect produced by H2 blockers are inhibition of gastric acid secretion, especially in case of ulcers and heartburn. The example of H2 antihistamine: cimetidine, ranitidine, fexofenadine, nizatidine. I hope you enjoyed this video and got the concepts easily. Appreciate my efforts by doing subscribe to my channel and don't forget to like and share it with your friends. Thank you for watching.